Shall I?
Yes, ma'am, go ahead.
It's okay.
I think some audio issues are
Can you hear
happening.
me?
Yeah, now it's fine. I'll just switch off your video.
Sure, sure.
Okay, I think we
I
should be
can.
okay.
Okay, fine. Good afternoon, everyone. Greetings from Kingdom of Saudi Arabia to all of you. And thank you for giving me an opportunity to speak in this interesting and the latest knowledge which everyone, especially the nurses, need to know. And this webinar on the scope of digital skills in improving the clinical nursing practice is very important. And I also greet all my panelists and the organizers, Dr. Nanda Prakash, and also you, Soumya, helping me so much with all the connections. And after listening to all the previous lectures by my presenter colleague from Italy, and before that, Dr. Savita, most of the things are you all are getting oriented to, but it is very important that what are the legal things which we need to remember when we practice this. We have such a huge ocean of data, AI in the clouds, and every
Ma'am, we've lost your audio.
messages start coming. If I want to
Oh,
shop, I'll look at a medical course bag, I click, and 10 other will keep coming. So, how much is our data exposed to people, companies, and retailers? We don't know what's happening to us. So, it's important to know, especially when you're in the hospital, what's happening to your data. And healthcare now has probably the most intensive focus on information governance. It's not hard to see why, because this use of effective information is very vital for proper patient care and effective treatment. And everywhere this ethics and legal comes in place. What are the regulations? What's the privacy issue? What is the mitigation of bias? What is the transparency and relevance in keeping this data very, very safe? What are the legal aspects which we want to talk about, learn about as nurses, because many of us are going to be in India, work in the hospital, work in the college, get into the hospitals abroad, and everywhere it is AI, data. You really need to learn about it. And how are you accountable for the governance, confidentiality? What are the liabilities, accuracy, and how you get into the decision making and try to protect the data. Now, when you talk about information governance in clinical setting, in healthcare setting, it establishes the centralized policies, procedures, and accountabilities for managing the life cycle of patient information. The life cycle of patient information, right from the time the patient calls, enters the hospital, enters his data, enters his Aadhaar card number, enters his phone number. The whole cycle of things starts about him, how much money he's paid, which super specialty OPD he's showing to, has he shifted to the angiography room, has the angioplasty been done, have you recorded the video of it, given it to him, have you set up a date for his another CABG? Every cycle, the life cycle starts, and it promotes the use of. So when this happens, when you do good governance, information governance, it promotes the use of trusted information that is essential for patient engagement and treatment. And every healthcare organization recognizes that information governance is a business imperative. Today, hospital is a huge industry. We call our patients clients. So this governance is a business imperative. You all must have seen that Netflix web series of Suits. There were some 9 seasons, and how the lawyers manage things. So it becomes a very, very business imperative here. However, the focus has been on data privacy and confidentiality. So, what are the seven pillars of clinical governance which govern? I will take the example of NHS here, how they govern. It was implemented in 1990s. I never even had a mobile then. I was so scared to attend a phone call then because I was a student. 1988, I joined nursing. I was a third year student in 1990s. Mobile, we never had mobiles in our hands. And that was the time when these NHS implemented the clinical governance. They were so advanced, and there was a Bristol hospital heart scandal, and later on these things, irregularities, stealing data, using data, getting all the Indian people get all the x-rays of tuberculosis, x-rays, the glass, the what is that glass door appearance of the COVID lung, and getting it transported by AI to GE Healthcare and other companies to some remote database. They trying to do research, publish it without the patient even knowing कि मेरे lung का जो सीटी स्कैन है, MRI स्कैन है, और जो मेरा जो कोविड स्कोर है लंग का, वो जा रहा है कहीं पे ना, तब बहुत ज्यादा प्राइवेसी की इश्यूज स्टार्ट हुए. And that is why we go back to 1990s and see the history, how it started. Why did we need clinical governance? The seven pillars were education and training of doctors, nurses, lab technicians, IT engineers, how to maintain data privacy, how to feed data, doing clinical audits, and what was the clinical effectiveness, how do the staff manage it, what is the patient and public involvement in regard to the data, the risk management, and the information management. So this became the seven pillars. When we talk about education and training, why was it important in regard to information law and governance? Because it was the responsibility of the trust or the hospital to oversee the continuing professional development of their clinicians, their doctors, nurses, everyone who dealt with computer and data and electronic, like previous speakers spoke about HIMS, Hospital Information Management System, PIMS. It is so important. Everybody needs to know how it happens. This means skill audit should be a regular part of your project governance in the hospital. Many hospitals abroad, you don't have case papers. Everything you have to enter on the computer, every data on the computer. Like now, when I'm teaching here in Saudi Arabia, there's no paper, pen, nothing. We have a Blackboard software where we have everything. The student attendance we take on that. We do the evaluation, teaching, everything on that. My salary, I can check on that. My leaves, my visa, when it has come. Everything has become so much computerized. Similarly, in the hospitals. And as and when we go, I'll give you interesting examples. So the first thing about education and training is you need to tell them, no, Baba, this is how you have to work, and this is how we will be taking audits. Be careful with the data. And then the clinical audit, which is a review of the clinical performance of a practice. Audit ensures that the standards are maintained. You repeat your CPR training, you repeat your resuscitation skills, you repeat your injection skills, you have this orientation induction training programs repeatedly in the hospital. Then what about the clinical effectiveness? This group of reviewers will review whether specific clinical interventions work. Are they cost effective? Like, high dose antibiotics, if it's being given by doctors in when they are in touch with some companies, now it has reduced, but is it necessary? What is the meaning of a rational antibiotic policy here? So all these audits catch all these things up and try to why this particular company stunts are used. They are so costly. Is there any cost effective stunt which can be used? Why surgical site infection rates are increasing? Why are cot infections increasing? Can we change the catheter? Can we have a less cost effective catheter and practice more infection control practices? So this kind of governance is required. And staff management, you need to hire the best quality staff and ensure that they keep up with their education and training throughout their time, which will help in the governance. Quality staff, people in my age group who have to learn. It is so hard for us to learn the new skills, AI, chat GPT. Just now I downloaded a few weeks back. So these are the things which we are picking up. But you are the younger generation, smart generation, you know everything. So it will not be a problem for you to get into any system across the globe and get trained and retrained with new skills. So the project management in the hospital will ensure, that all the projects are governed correctly and by the right people. Then the patient and public involvement, the fifth pillar is about transparency with stakeholders is essential for good governance. You have to take their permissions to give the data. Every hospital gives data about the number of COVID cases, deaths, heart surgeries, any epidemics. It is a policy of the nation, of the country, where they go through the hospital to the state and state to the country and then to the global to know the statistics, the incidence, prevalence, all this. And clinical practice should never be shrouded in secrecy. ऐसा नहीं होना चाहिए कि some of the doctors are working with some remote research for their own interest and they are giving away the data. हमको कुछ समझ में नहीं आता because we don't know what's happening. Computer खुल जाए, दो बटन दबा दे कीबोर्ड में, that is more than enough for us. So we should not be the reason, that data right under our nose is being transported. So it should never be shrouded in secrecy. That is what it means. And when you talk about risk management, there are three components to risk management here. किस को risk हो सकता है? Risk can be to the patients. So you have to compliance with the statutory regulations of the hospital, the regularly reviewed and questioned systems. Check the systems. कुछ leak तो नहीं हो रहा. I remember in one particular university, which I wouldn't name, the IT guy was in touch with parents for the ranking of the NEET, and there was some gadbad happening and admissions happening. It was caught and he was suspended. Very, very prone. People are very, very prone to these things. Critical event audits, क्यों इतने सारे deaths हो रहे हैं? Ventilator failure है, या the nurses who are there are not skilled to operate this new ventilator because the management likes this new thing. पुराने निकाल दिए, नया आ गया. I was trained in the purana and this naya is new to me. So what do I do? Learning from complaints, and finally, medical ethics standards. So all these points cover the risk to patients. What is the risk to the practitioners? This means protecting the workers through access to immunizations, creating an anti-harassment and safe working culture, and keeping employees up to date on basic safety, including fire safety. Hospital में आग लग गई and you have no clinical governance system where you teach everyone क्या करना है, what is code red, code blue, code purple, code pink, baby abduct हो जाता है, everyone knows about it. So it's our duty to inform, train every worker around it. That is what the Quality Assurance Cell of India through NABH does for the hospital. Then you have NAC accreditations for the university where quality standards are maintained. It's important risk to practitioners, risk to the hospital, to the organization. Very, very good governance at every stage of processes is required. This can only be achieved by employing the best, creating a safe environment, and engaging with your stakeholders who are the patients, the community, the people who sell machines to you, your traders, because you're an industry. So there are likely to be tires to the priority of these risks, but you should try to address all these risks as often as possible. When you talk about the seventh pillar, it is about information management, governance, which is very important in every industry, but hospital may especially important with special category of data of patient information and other sensitive information every day. It is of the utmost importance that this information is managed properly, very confidentially, and I will be giving you examples and I'll tell you what happens if we are unaware of it. So when you talk about क्या है information governance program hospital में, what does it constitute of? It has a council, a very, very important council, and defining the value of business information and reaching out to the entire organization. So if you see that information governance typical functions and role towards the right, you see you have duty, value, and asset. Duty क्या है? To hold and discover data. What is the value? To create use for it, retain it, archive it in electronic medical record systems, and then dispose it. And what is the asset? How you store it and how you keep it securely, like no one steals. हम कितने सारी movies देखते हैं Netflix में, वो जाते हैं किसी के यहाँ CIA. I to watch so many how they take data, how they hack, how they collect data. You know, all that interesting things really, really happen in the world. And जब you have duty, value, and asset in between, you have your hospital policy integration, which covers it so well. And there are business, profits, privacy issues, IT efficiency, the RIM risk, the legal risk, all this together, are the unified governance of the hospital. So for that, you have a legal department, you have risk management, compliance, records management, information technology, and of course, the security of the information. Now let's go one by one into all this. What does the legal department in the hospital do? So it's not only physically stealing the data, but also the online data which is in the computers, in the cables running around, reaching from the lab to the computer to the ward, you know. So it needs to be involved with anything that affects the organization's litigation exposures. Some patient relative comes, sits there, collects all the information on the computer. You're a nurse who doesn't know what he's doing, how to protect password, very important. It should help set policies for the usage and privacy rules of the communication channels, you know, emails, social media and mobile devices. ईमेल्स भी अनप्रोटेक्टेड होते हैं, आपने फॉरवर्ड कर दिया किसी और को समन से, नहीं नहीं आपके सिस्टम में है, मुझे चाहिए मेरे रिसर्च के लिए, एथिकल क्लियरेंस ही नहीं मिला, पर बहुत इंपॉर्टेंट है, या फॉरवर्ड कर दे, यू जस्ट फॉरवर्ड द ईमेल जो आपको आया है, आपने भेजा है टू somebody else. It's a fraud, like, so these are legal things which you should know of. It needs to be included in the policies and approvals around defensible disposables, as well as communicating with the business units about the status of legal holds. I remember I was working in the hospital side, college side, both. Every time legal, I have to sign some legal things. क्या हुआ? I used to ask that person who used to go, नहीं मैडम ऐसे केस हो गया, so I have to go to court in Bangalore. So there's so many things happening which we do not know. And in terms of e-discovery, the legal department should be involved in setting the policies कि कहाँ information is located, कितना secure है, how it can be accessed and how it can be presented. This is what the legal department does. About risk management, you have to identify, analyze, take action, monitor the risk and control it. The risk function will work very closely with the legal department to take all aspects, mitigate all aspects of information risk in terms of litigation exposures, regulatory compliances, and damage to corporate reputation. कुछ भी लीक हो गया, पूरा हॉस्पिटल का रेपुटेशन गेट्स खराब कि ये क्या हो गया. कोई किसी ने एक मोबाइल में फोटो ले लिया कि वो पेशेंट को ठीक से देख नहीं रहे हैं, रूड है, दे आर ट्राइंग टू do the CPR skills incorrectly, and somebody is using a selfie, he puts in social media, it reaches the wrong hands, the corporate is in risk. So it's very, very important that you don't unnecessarily take selfies, use mobiles, do a dance, do a hand wash dance, put it in the media until and unless your corporation legitimizes it, you're correctly using the 7 steps in your dance performance, otherwise it will hit back to the industry. And this risk management department closely works with IT in areas of disaster recovery and business continuity. Whenever you walk into a hospital, just see there's an IT cell, there's an IT engineer who is so much underrated, but he does a lot of work. You can't even know how he does the data mining, data privacy, everything in the hospital, how he manages the AI data, everything. So do not underestimate him. The risk function will also require visibility of how and where different information is stored and how it is destroyed, ई-वेस्ट. अभी हमारे यहाँ पे जब ऑडिट्स होते थे, पूछते थे हमें कंडेमनेशन कमिटी है क्या, तो हम बोलते थे हाँ वी कंडेम्ड ऑल ओल्ड फर्नीचर, ओल्ड कॉट्स, ओल्ड वेंटिलेटर्स, ये वो. नहीं नहीं, ई वेस्ट किया क्या आपने? ई वेस्ट वाला एक अलग बंदा आता है बैंगलोर से, ही कलेक्ट्स ऑल द e-waste and the hardware waste and goes. So these are the things which are there in every hospital. You need to just open up and see them. Compliance क्या करता है? Compliance should be involved in determining कि जो information which is stored and which is accessed, as well as the establishment of internal measurements and controls on this information. Everyone can't open it and take it in their pen drive secretly and go. No, it should manage enterprise audit process, as well as it should be equipped to deal with requests from regulators and auditors. Auditors से बोलेंगे कि हमें ये वाला डाटा चाहिए, आपका हमें रेस्पिरेटरी ओपीटी का ये डाटा चाहिए कि क्या हो रहा है, कितना, कौन सा मेडिसिन कितना यूज हुआ, कितने स्टेरॉइड्स यूज है, कोविड के कितने केसेस आए थे, क्या था. Like you should be able to give it to the regulators and auditors, not to any Tom, Dick and Harry. Then what to do with the records management? Jo records management is responsible for how paper and electronic medical documents are categorized, stored, and managed. In addition, this function also involves the setting up in place of policies and procedures, जहाँ पे you capture and manage new information types from BIOD, social media, and cloud services. Again, यहाँ पे compliance works closely to determine how information should be handled throughout its life cycle. So this looks very dry and boring to you, but these are the very important components, and every hospital has it in place. Then when you talk about so much of IT technology which is there, then you have an information governance role of IT, which manages the volume of data which is affecting the organization. कितना बायोमेट्रिक्स है, कितने लोग आते हैं, उनके लीव्स जो आते हैं और एचओडी एक्सेप्ट करता है, वहां से लेके रिसेप्शन में व्हेन द पेशेंट एंटर्स, उसका डाटा, एवरीथिंग इज organized. It should involve effectively the use of IT infrastructure and storage, as well as removing redundant technology and systems. पुराने systems, कई hospital में, कई nursing colleges में computer lab है, तो वही पुराने 10 non-functional computers you keep. How will your students learn to use computers? So latest technology system should be there, old one should be removed, latest Windows software, latest SPSS package, all the things, red cap software to analyze data. There's so many things, and it is involved in all aspects of information governance. Then you have the security of this information. It is very important. The information security, it is responsible for an organization's security strategy, policy, and management. Kitna data leak hota hai? This function should be involved in anything related to security and privacy information. And they work with compliance, they work with records management, and ensure that jitna bhi information hai, it meets the organization security and data privacy policies. When you talk about towards a very comprehensive information governance strategy, then you have every healthcare organization, every hospital should have, they have, you have to go and discover. You say, someone was saying in our hospital, in our college, it is not there. 100% it is there. I know BLD University. I know how BLD University collaborates with KLE to do lot of data work, millions of dollars of research grants which come from TJU and Bill and Melinda Gates Foundation, how data is collected, transferred. Go talk to your obstetricians, go talk to your community researchers, go talk to them how the apps are used to train the ANMs and to record warning signs. Many things are happening. We are ignorant. So just open your eyes. It's there everywhere. India is the best. India is into it. So hospital mein you have the cross-functional information governance committee. You have organization, wide strategy, consistent information keeps coming. You have the framework, you have to develop the existing framework. People don't come to us, we have to call the best of the IT people, software people, take quotations, select the best, implement it. You need to also empower the employee. अभी मुझे ही नहीं आता कि मैं अपना लीव कैसे चेक करूं, अपना सैलरी कैसे चेक करूं, पेशेंट का डाटा कैसे डाउनलोड करूं, कैसे उसका पीडीएफ बनाऊं, कैसे उसको सेंड करूं मैं फिजिशियन को, ही इज आस्किंग फॉर इट. And then continuous improvement. So the speaker, Dr. Savita, was telling the use of different basic computer softwares. I am not talking about them that we assume that all of us should know, learn. I'm talking about how the organization needs to empower us and how continuous improvement needs to happen. And so whenever we talk about information governance, it simplifies, accelerates, transforms. What does information governance do? It helps to simplify, it helps to accelerate, it helps to transform the whole system of governance and creates operational excellence. So when you talk about ethics, ethics है हर जगह ethics है, पर health informatics ethics में combination of medical ethics, ethics basic, informatics ethics. यहाँ पे we are not talking about some social ethics or some, you know, bioethics. No, we are talking here about health informatics ethics. It's a combination of all this, and these are the 9 main important things: confidentiality of the e-information, the data, avoiding harm. यहाँ पे अवॉइडिंग हार्म ये नहीं कि पेशेंट गिर गया, वेट फ्लोर था, पेशेंट सेफ्टी नॉर्म्स नहीं थी. यहाँ पे अवॉइडिंग हार्म मीन्स कि पेशेंट का जो डाटा था, डिजिटल डाटा था, वो आपने मिसयूज किया क्या. डिफाइनिंग प्रोफेशनल रिलेशनशिप. किसी किसी मेडिकल रिप्रेजेंटेटिव ने बोला अरे हमें दे दो, वो पेशेंट तो लाइफ लॉन्ग मेडिसिन पे रहेगा, आप हमें दे दो, हम उनको हॉस्पिटल के बाहर कांटेक्ट कर लेंगे, फिर हम कुछ कर लेंगे. So that is what is going against the trust of the hospital, and without patient's permission giving his data to someone. डिफाइनिंग प्रोफेशनल रिलेशनशिप्स का जो एथिक्स है. इन्फॉर्म्ड कंसेंट, आपको पता है वी नीड टू टेक इन्फॉर्म्ड कंसेंट इवन फॉर taking the data of the patient. Establishing fees and financial arrangements with companies, patient, all these needs concern. And maintaining records and data is an ethics. Forwarded emails, I was talking to you ना, किसी का ईमेल इतना important है और आप किसी को फॉरवर्ड कर देते हो, वो किसी और को फॉरवर्ड कर देता है जो जो मैलिशियस होते हैं. ये तो आपका बंदा था, आपका फ्रेंड था, आपने कर दिया, पर ही अगेन फॉरवर्ड्स इट टू समवन हु मिसयूज इट अगेंस्ट द हॉस्पिटल. ईमेल एड्रेस लॉग्स होते हैं, यू हैव टू रिमूव देम, डिलीट देम एंड प्रोटेक्ट द डाटा. सो दिस इज ऑल अबाउट हेल्थ इंफॉर्मेशन एथिक्स. इसके लिए भी इंटरनेशनल मेडिकल इंफॉर्मेटिक्स एसोसिएशन इज फॉर्म, विच फॉर्म्स अ कोड ऑफ ethics for conducting specifically for medical interpreters. A code of ethics here is necessary for medical interpreters to maintain standards for the individuals within that profession and to adhere to it. So it brings lot of accountability, lot of responsibility and trust to the individuals that the profession serves. So this was a code of ethics created only for it. इसमें part 1 में principles है ए एंड बी, जहाँ पे जो फंडामेंटल एथिक्स प्रिंसिपल्स है जो हम सब जानते हैं: ऑटोनॉमी, इक्वालिटी एंड जस्टिस, बेनिफिशियंस, नॉन मेलिफिसेंस, इम्पॉसिबिलिटी, recognizing that some things are impossible नहीं कर सकते, and integrity. The same applies to digital ethics, information law and governance. And B is general principles of information ethics like information privacy and disposition, openness, उसको सिक्योर करना, पासवर्ड प्रोटेक्ट करना, स्ट्रॉन्ग पासवर्ड्स रखना, उसका एक्सेसिबिलिटी कंट्रोल करना, लेजिटिमेट इन्फ्रिंजमेंट्स रखना कि इस बार के बाहर वो नहीं जा सकते, क्योंकि ये हॉस्पिटल अथॉरिटीज के साथ हमने पूछ के, ये आईटी वाले के साथ पूछ के हमने ये एडिशनल सिक्योरिटी डाला है. लीस्ट इंक्लूसिव ऑल्टरनेटिव्स एंड अकाउंटेबिलिटी. सो दिस इज अबाउट द पार्ट 1 इज अबाउट प्रिंसिपल्स एंड पार्ट 2 इज अबाउट rules of ethical conduct, जहाँ पे you have subject center duties. Subjects of electronic records are protected from abuse of their information. You have duties towards healthcare professionals, HCPs, that is the B part, where you focus on proper support, keeping the HCPs informed of relevant information, maintain standards of data storage and intellectual property rights. Very important. C is duty towards the institutions, the employees, जहाँ पे again integrity, loyalty and ensuring the safety of the institution's data. जो evaluating the system security, you evaluate and you tell them ये ठीक नहीं है, I could easily reopen it, it was not password protected, then they will do more strong passwords. Alerting and informing the institution of problems in good time and working within their scope of competence. अच्छे टाइम में अगर आप प्रॉब्लम नहीं बताओगे, खराब टाइम आया तो डाटा रिट्राइव नहीं कर पाओगे, तो क्या करोगे. So D is duties towards society, where you have to include proper collection, storage, and safeguarding of this appropriate data and informing the public and not participating in work that violates human rights. And if you see the E point, it is self-regarding duties, जहाँ अपने आप के limitations आप recognize करो, बोलो I don't know this, I may do mistakes, I may not be able to save, फिर मेरे से कुछ problem हो जाएगा, data leak हो जाएगा, please try to help me, please send someone. And maintaining competency and avoiding any kind of conflicts. F is duties towards the profession, where it includes not bringing the profession into disrepute. Are all the nurses are stealing the data. We don't want our profession to get into the. We are such a good profession. No kind of disrepute because of lack of knowledge, lack of skill. कुछ ना कुछ हो रहा है हमारे साथ. Impartiality and assisting and maintaining standards of professionalism among colleagues. I'll give you some examples. I will read it like this only. कि क्या हुआ था कि हम क्यों इतना पढ़ रहे हैं इसके बारे में. On a January night in 2019, somewhere in the United States of America, Israel Mirsky was waiting. He waited until the cleaning staff opened the doors, then entered the hospital premises. Okay, and he installed his device in a CT scan room, in a computerized tomography CT scan room, hidden under a panel in the floor. This device accessed the hospital's PAC system. You know what's PACS? PACS बोलते रहते हैं. It is a hospital's picture archiving and communication system. तो इस बंदे ने ऐसे किया. He went and he tried to hide something. And what are these PACs? PACs are fixtures in many hospitals and they exemplify both the advantages and disadvantages of digitization. मतलब they are the best example कि advantage भी हो सकता है, disadvantage भी हो सकता है. One of the disadvantage is the vulnerability to intrusion. कोई भी आके like PACs are designed to be accessible, you know, and many are connected to the web for remote access, enabling search engines जैसे shadowin.io to find them. तो they are all web access, remote access रहता है. Doctors can use them in their mobile phones. They are traveling, they are in a conference somewhere, and otherwise in general they have web access to the companies. तो पैक्स को अगर कोई मिसयूज करेगा तो क्या हो जाएगा. तो just using a piece of artificial intelligence, you know, that is a AI software, which is known as the generative adversarial network. What did they do? They tried to um, this device, ये जो device था, it was using a piece of AI software. What it started doing, it started altering CT scans of patients' lungs, inserting or removing tumors as appropriate. ऐसे सब करने लग गया ये AI के through. And what did Mursky say? He said, we did not reveal the vulnerabilities in the pack, but जो रिसर्चर है at the Ben Gurion University Cyber Security Research Center in Israel, he said that we were adding that it was done with the hospital's full consent and that the patients were not affected by the experiment. तो अभी मैं आपको सीक्रेट रिवील करती हूँ. ये एक एक्सपेरिमेंट था, ऐसा हुआ नहीं था, पर उन लोगों ने हॉस्पिटल को सिखाने के लिए खुद ऐसे किया. हॉस्पिटल के परमिशन से चेंज करने लगे क्योंकि वो ये सिखाना चाहते थे कि ऐसा हो सकता है कोई भी घुस के कहीं पे भी. अभी जैसे मैं इंटेलिजेंट हूँ, मैं अटेंडर हूँ, मेरी मदर इन लॉ को सीटी स्कैन के लिए लेके गए, मैं अकेली हूँ अंदर, और लेड का वो डाल के मैं घुस गई अंदर और मैंने कुछ डाल दिया एआई सिस्टम, आई वांट ऑल द डाटा, समबडी इज पेइंग मी लॉट ऑफ मनी, कर दिया. तो यह एक्सपेरिमेंट प्रूव करने के लिए इसराइल के ये साइबर सिक्योरिटी रिसर्च सेंटर वाले साइंटिस्ट ने ये किया पूरे कंसेंट के साथ. फिर क्या हुआ, that a hospital's digital system should be so open to cyber attack and that AI should be the weapon used did not surprise Timo Minson, who is the managing director for the Center of Advanced Studies in Biomedical Innovation Law in Copenhagen. He told, उसने तो कहा कि web connected digital health systems are highly vulnerable to attack. And he said, like any other technology, AI can be used for both beneficial and harmful ends. So this was the thing. We are using AI. I am well versed with AI. अभी नर्सिंग में AI आ रहा है. Simulation INC के जो है SGBT यूनिवर्सिटी में using those high fidelity simulators is AI technology. Computer based system में you alter the vital signs, you alter everything. The multidisciplinary group is working. Patient revive हो रहा है, आप फिर कुछ BP गिरा देते हो. All this is AI. Another thing, Europe's General Data Protection Regulation, GDPR, which governs the use of personal data, including health, biometric, and genetic data, requires that Consent should be obtained from patients regarding the use of their data. It also includes research exemptions. नहीं कर सकते रिसर्चर्स को तो ऐसी चीजें चाहिए होती है अभी नया रिसर्च करना है हमें एआई के थ्रू सारे आपके टीबी के केसेस के लंग्स दे दो हमें कोविड के लंग इमेजेस भेज दो हम डाटा करेंगे डाटा माइनिंग करेंगे नहीं it keeps lot of consent imposing anonymization where consent is not obtained. तो Feb 2020 में European Commission published an AI strategy that stressed continued enforcement of the GDPR. अब जब भी पढ़ोगे ना AI के बारे में GDPR वर्ड यूज होगा तो GDPR is General Data Protection Regulation which protects personal data and privacy. अभी what about India? इंडिया में Pam Dixon, she is the executive director of the World Privacy Forum, which is a research group which focuses on data privacy. She assessed the Aadhaar system between 210 and 216 in India and questions whether the tightening of regulation in India will make much difference. Because Aadhaar is a very good example of a biometrically based digital program which reaching a point of pervasiveness, anyone can enter it, which makes it very difficult to regulate. She says she worries about the accumulation and sharing of individual data, which are then used to establish predictive health scores, which are widely disseminated. कितनी बार हॉस्पिटल में गए आपका आधार कार्ड नंबर क्या था आपको ये डिजीज था अच्छा आपको हम इस कंपनी से कनेक्ट कर देते हैं इनके साथ आपका ट्रीटमेंट होता रहेगा हमें हमारा ये मिलता रहेगा दिस काइंड ऑफ थिंग्स अभी जैसे सऊदी में जो आधार कार्ड है वो इकामा कार्ड है तो हमारा इकामा इज लाइक हमारा आइडेंटिटी कार्ड किधर भी चले जाए मैं यहाँ पे एक सेहतिया ऐप है उस ऐप के थ्रू ये करो यू कैन टेक वर्चुअल अपॉइंटमेंट विद डॉक्टर्स आई हैव टेकन अ वर्चुअल अपॉइंटमेंट विद अ डॉक्टर ऑन 2 October at 3 p.m. बिकॉज मुझे इतनी दूर नहीं जाना है और मुझे ऐसे कुछ है नहीं कि आई जस्ट वांट टू आस्किंग कि आई वाज नॉट वेल and I was feeling a little weak. Can you give me some B complex and some multivitamins? Can I take my old medicines which I'm taking? Can you prescribe it for me? ऐसे चीजों के लिए तो इतना सारा एडवांस है हमारे वीजा के लिए मैं किसी मेडिकल शॉप में जाके मेडिसिन लूँ तो मेरा इकामा कार्ड से पता चल जाता है कि इसने यहाँ से मेडिसिन लिए ये यहाँ गई ये इसका बायोमेट्रिक्स है एवरीथिंग इज क्रिस्टल क्लियर जैसे आधार कार्ड है इंडिया में तो दिस आर द थिंग्स एक नए बच्चे से नवजात शिशु से आधार जो बन गया उसका हर इंफॉर्मेशन जो है वो क्या हो जाता है परवेसिवनेस हो जाता है उसका कोई भी मतलब ले सकता है कैसे भी ले सकता है अब इफ यू आस्क मी आई एम नॉट सो इंटेलिजेंट मुझे नहीं पता कि मैं कौन सा डाटा लूं कैसे लूं मैं क्या कर सकती हूँ मुझे नहीं पता बट देर आर पीपल हु आर हैकर्स इंटेलिजेंस आईटी हैकर्स हैं कंपनीज फार्मा कंपनीज IT companies, they use them to hack and get information and sell. So there are all good and bad points for everything. And when you talk about this, this Bernardo Marino, he's the director of the World Health Organization's department. आप WHO वेबसाइट में जाइए मैंने वहां जाके ढूंढा क्योंकि ये टॉपिक वाज वेरी न्यू आई डिडंट नो व्हाट टू टॉक फ्रॉम वेयर टू गेट एग्जांपल्स व्हेन आई क्लिक WHO वेबसाइट आई गॉट दिस आर्टिकल अबाउट दैट CT scan में जो AI यूज हुआ था from there I tried to cut paste some of them into my slides. So if you go to the WHO website, there is a Department of Digital Health and Innovation, Digital Health Security Regulations and Ethics. So this was one of the most important issues which was discussed when WHO's global strategy on digital health was presented to member states at the World Health Assembly in May 2020. So in addition to these policies, the whole global community, healthcare community needs to collectively establish a health data intelligence monitoring system or framework. Like it is so important, health data intelligence monitoring system or framework to detect and to report on health data misuse and all associated cybersecurity risks, he says. So this is my concluding slide and the source here is from WHO. You can go through and get this and get many more things. Because of lack of time, I'm just trying to क्योंकि वी आर ऑल सेम इन द सेम बोट जितना मुझे आता है उतना आपको आता है एक दो बॉयज हैं जो काफी इंटेलिजेंट होंगे जिनको बहुत सारा आता है आई डोंट नो मच अबाउट कंप्यूटर्स आई एम जस्ट ट्राइंग टू लर्न एट दिस एज बट आई थॉट दैट we must have these examples and thank you so much for giving me this opportunity. I will try to stop sharing the slides and there are books on health informatics. There are chapters on this, so you can go through them, Google and see. I'm stopping the slide share.